Welcome to the webinar entitled Wisconsin HIV Surveillance Annual Review, New Diagnoses, Prevalence, and Deaths through December 2017. This webinar has been divided into 4 sections. The first section will provide background information about the data and methods used. The second section will cover new HIV diagnoses in Wisconsin. The third section will cover HIV prevalence, HIV care outcomes, co-infection with sexually transmitted diseases, and deaths among people living with HIV in Wisconsin. The fourth section will cover HIV surveillance data specific to the city of Milwaukee. The 4 sections should be completed in order. In addition, there is a module that reviews data concepts commonly used in the figures and graphs shown in this webinar. It may be helpful to listen to the data concepts webinar prior to completing sections 1 through 4. This webinar is being narrated by Ashley Byes of the Wisconsin HIV program. Data included in this webinar are based on individuals diagnosed with HIV and AIDS through December 31st, 2017, who were reported to the Wisconsin HIV program's surveillance unit. HIV and AIDS are reportable conditions in Wisconsin per state statute. This means that a case report form providing basic information about the diagnosed individual needs to be completed and submitted to the Wisconsin HIV program within 72 hours after HIV diagnosis. HIV surveillance data from these reports are then analyzed and compiled in a report at the end of each year. The purposes of the annual report are to assist planners of HIV prevention and care services to better serve those at risk of acquiring HIV and those who are already living with HIV, ensure effective use of existing resources, and seek additional resources where most needed. Today's webinar is based on highlights from the 2017 annual report, which, along with a number of other reports, is available on the Wisconsin HIV program's website. The URL is provided on the slide. The next few slides provide background information on the source of HIV data in Wisconsin. The next few slides will help us understand the flow of people living with HIV in and out of Wisconsin, and who is included in the estimates of new diagnoses and prevalence. Imagine this graphic represents individuals living with HIV in Wisconsin. Each year, there are 3 different groups of people living with HIV who are counted in the annual report. The first group are those who received their initial HIV diagnosis in Wisconsin during the calendar year and are being reported for the first time. In this diagram, these people are represented in red. These new diagnoses give an indication of how prevention and testing strategies are working. In 2017, there were 259 new HIV diagnoses made among Wisconsin residents. The second group of individuals in the report are those who were diagnosed elsewhere but moved into Wisconsin during the calendar year. Many of these individuals have been living with HIV for many years and therefore are different than those who are newly diagnosed in Wisconsin. Individuals who were previously diagnosed and moved into Wisconsin are not included in the analysis of new diagnoses, but they are included in the prevalent population. There were 231 individuals previously diagnosed in another state or country who moved into Wisconsin during 2017. The third group of people are individuals who are already living with HIV in Wisconsin. They were diagnosed or moved into Wisconsin prior to 2017. Before we can calculate overall prevalence, we have to account for individuals who moved out of the state or died during the calendar year. These are subtracted from the overall prevalence. To calculate Wisconsin's 2017 HIV prevalence, we count the new diagnoses in 2017, add the people moving into Wisconsin, add individuals already living in Wisconsin from past years, and subtract those who died or moved out of state. The 2017 year-end prevalence was 7,123. However, the Centers for Disease Control and Prevention estimate that 15% of people living with HIV in Wisconsin, or 1 in 7, are unaware of their infection. So the actual number of people living with HIV in Wisconsin is probably close to 8,300 people. To be consistent with the Council of State and Territorial Epidemiologists' position statement on transgender HIV surveillance, and to provide stakeholders, partners, and community members with more information on how HIV affects transgender persons, the report no longer uses sex assigned at birth, but rather gender identity. Individuals are counted as transgender for this report if they identified as transgender on an HIV report or laboratory document, or if there was a mismatch in the birth sex and the sex or gender reported on any of the previously mentioned documents. In 2017, transgender gender identity was not further verified. Therefore, some individuals may be mistakenly counted as transgender in this report if sex or gender was incorrectly reported on any document or if data entry errors occurred. This concludes Section 1 of the webinar.